There may be a program that you're looking at, or if you're just looking at changing your career, I'm going to show you the whole entire school. I want you to see every program that we have. I want you to see every lab that we have. And then from that point, I want you to be able to see, do you actually see yourself sitting in one of these classrooms, sitting in one of these labs, or doing one of these jobs?
So when you're in school, you're just trying to learn how to weld, like how to form two pieces of metal into one. That's the first thing. And so there's different types of welding for different jobs. And so Allstate, they just gave us a little bit of everything. They taught us a little of every type of welding, so when we got into the field, we were prepared. So when I got into the field out of Allstate, I was more prepared than some guys who were already working because I had learned so many different things.
Air conditioning, heating, and refrigeration, so they can specialize in some areas versus others. They can be maintenance people, they can be installers, they can be repair techs. There's many things they can do under the HVAC umbrella. And since we need AC and heating all year round, you can work in any state.
If they wanted to be a nurse, if this is something that's interested them, I think this is an excellent way to start their nursing career. They can begin as an LPN and they can go back to school later on and being RN and get their MSN, they can go into their graduate level, or they can make a career choice out of being an LPN. It's an excellent way to make a living. It's a 15-month program where they will be started, and within 15 months, they could be working.
I have people that actually call us and ask us, do you have any students? Because they know that when they go out in the field, they have all hands-on training. So we have places that have hired 5, 6 of our students that are graduates now.
I work at an emergency dentist office, so we see bike accidents, car accidents, things like that. Basically, we focus on the teeth aspects. So we have the patient, if they already had an accident or something like that, we have them come in after they left the hospital to do the procedure as far as if it's any repositioning, things like that. And then we also do see our patients for routine cleanings. We do orthodontics at our office, oral surgery, periodontics, and endodontics also. And we also do the general dentistry aspect too.
As an EMT, most of the time we're going to be doing lab work because in the beginning we do most of the textbook stuff. You learn the basics, your anatomy, what you would do in a scenario, scene safety, how you would approach a patient and what you would do in certain scenarios. But it's better because you get to go to the lab and put your knowledge to work. You get to put the lecture part with the lab and put it all together, and then it makes sense.
It's easy enough to train somebody to pass a test, all right? But what we teach is we teach about life on the road. We teach about numerous things that you're gonna run into on the road. We don't just train you just to pass a test and get out there and drive a truck.
understanding how to assess a patient to get them prepared for the doctor. You're learning vital signs, you're learning phlebotomy, which is drawing blood, you're learning urinalysis techniques, you're learning how to perform throat cultures, you're learning EKGs. There are a few other tests that we learn how to do. You learn how to administer injections. We perform lots of wave testing, which are tests that a medical assistant can perform without having to ask the doctor for permission. And that's in preparation so that when the doctor comes into the room with the patient, they're good to go.
So for me, early mornings, I come in at 7:30 and I open up the rooms, make sure the rooms are set and ready for the doctors, take out each instrument for them for that day. As soon as the patient comes in, I call the patient back. I take their vitals and their height, their weight, their blood pressure, and their pulse.
So medical coders and billers are very important to the medical practice because they make sure the bills get paid so that everybody can get paid. So the medical billers and coders really focus on the front end. They do the administrative tasks. They make sure that they verify the insurance of the patient. They make sure that the insurance is going to cover the payment for the procedure that's done. They make sure that money is coming into the practice. So medical billers and coders are very important.
Education in the United States has not fundamentally changed in the last 150 and 200 years until schools like this. This is, as we get back and we talk about the college education, we prepare students for employment. So all of our classes, all of our subject matter are with that in mind.